Hi guys, I want to tackle a question today that I get asked frequently, and that's how many procedures can I do together? Which to me is really another way of asking how long can I be under anesthesia? Well, fortunately, there's a pretty firm answer that we know about. It's been well documented in our literature as a safety measure that most patients should not be asleep more than about 6 hours for surgery, okay? And I'm not saying that you can't ever be asleep longer than that, but the key is that we want to be done with our surgical portion within 6 hours. So if we include anesthesia time, maybe we could take that up to 6.5 to 7 hours or so, okay? What we really don't want to be seeing is marathon surgeries where we're going 9 or 10 hours. And what we really don't want to be seeing is when somebody's trying to break the rule by doing a 5 hour surgery one day and going back to surgery the next day for another 5 hours. So if you start thinking about major procedures, probably ends up being 2 to 3 procedures can be done at one time, not more than that. And it really depends on the procedures that are being done because the ultimate thing that happens when you're in long surgeries is blood loss. Okay, that's really the limiting factor for most of the surgeries I do. Is how much surgery can I do without losing too much blood where I need transfusion or something like that? Because the longer the surgery, the greater the blood loss. The greater the blood loss, the greater the risk of needing transfusion, the greater the risk of infection, the greater the patient's gonna split open from swelling because they're needing a lot of fluids and all sorts of bad stuff, okay? So a breast augmentation, in my opinion, should never take more than 2 hours. A great indication of a surgeon's ability is their operating room time. A tummy tuck should never take more than 3 hours. If we're doing a lower body lift, it should never take more than about 5 hours to do. Okay, and this includes anesthesia time that I'm talking about. So the actual surgical time is much less. So if we're gonna try and do the breasts and do a lower body lift, then we're gonna be close to 7 to 7.5 hours. And for certain surgeons, if it's not that bad, you might be able to do it. But for most surgeons and most patients, it's not a good idea. That means you're not gonna be able to do as much liposuction too, because you're gonna be losing out on blood loss. So there's always gonna be some sort of trade-off. So make sure that wherever you're doing, your surgeon is board certified by the American Board of Plastic Surgery, that it's being done at an accredited facility. The best would be a hospital, as I've discussed previously. If it's going to be a surgery center, highly recommend that you have some way of staying overnight or a nurse to monitor you, especially a longer surgery. It's really not a good idea to be going home or be going somewhere without monitoring particularly if you have bleeding afterwards. Those are when risks of death occur and things like that. Okay, so everybody keep safe out there, do your homework, and make sure you get 2 to 3 opinions before major surgery. Thank you.